Whenever the child homicide has been committed and we are investigating such a case, one has to look for the causative factors that led to such circumstances. So the investigation is quite tricky in these cases and is carried out in a quite a different way. The histological appearances are of significance over here, and so in this section we'll be summarizing the different histological appearances in the different causative factors that can lead to such a child homicide. Of course, we have to differentiate such a homicide from the accidental causes as well. Now, the histology of the sequestered parts that is taken, for example, the lungs, the brain, the liver, the kidneys, that are sent to the histopathologist for the further assays and that are dealt in detail over here. The role of resuscitation is quite common and it is of high significance over here, whether the resuscitation was carried out in such a case or not. The estimation of maturity, it's again going to basically summarize the fact the age of viability is very important if we are considering the neonatal deaths and the infanticides and as well as the adolescent deaths in such a case. The histological appearance of the newborn lungs is quite significant over here and the sections have been sent to the histopathologist. The factors for the fetal maturity that the histopathologist has to look for are the height of the epithelium as well as the shape of the alveoli. These are the factors that he is going to look for just to see whether the maturity has been attained or not. The lung parenchyma, it develops in the fetus and as branching ramification of the trachea. At intermediate stage, the gland-like structures they develop and the epithelium is usually cuboidal or columnar in nature. The thin-walled adult type alveolus is another phenomena and it is complete before the full term. Alveolar spaces are quite distended in such a case and there is no visibility of the intra-alveolar epithelium in a thin-walled adult type alveolus. The lungs cannot be distinguished from the breathed lungs. And the maturation of the fetal lung, that has to be also established by the chemical pathologist just to attain whether the age of viability was attained by the infant or by the neonate or not. If it is fully expanded alveoli, it is basically representing the full-term births. And then if we have the glandular air sacs of the lumen, the air sacs are filled with the amniotic fluid, and in congenital bronchotracheal atresias, it is another phenomena that can occur and that is going to basically point out towards the maturation of the fetal lung. The breathing is basically established if the alveoli enlargement is seen in such a case. So the characteristic parts that are not connected to the bronchial system, they are even examined at this level, and these shows they are showing basically the alveolar ducts and the alveoli in such a case. The fetal lung transplantation, it's again a very common phenomena and is basically the anterior chamber of the animal eye that is basically used, and it is developed alveoli with the terminal bronchioles. Entry of the air into the lungs, that is also established by the histological examination. Now, the role of resuscitation and how we're going to establish whether resuscitation took place or not. It leads to the post-mortem aeration of the lungs, and the artificial respiration cannot cause the uniform aeration in such individuals. Difficulty in breathing is noticed in such neonates, and the patchy appearance of the lung expansion takes place after the resuscitation has taken place. So we can have an artificial respiration as well as we can have a difficult breathing phenomena. And how are the lungs going to appear after this difficult breathing phenomena? Difficult to distinguish between the two cases, whether artificial respiration was given or whether it was a difficult breathing phenomena. So, but still you have to comment upon it working as an autopsy worker or working as a forensic medico-legal officer, whosoever is carrying out the autopsy, one has to establish that either it was an artificial respiration phenomena or either the breathing was quite difficult by the infant or the neonate. Breathing for significant time or breathing for a longer time, how it is going to be established that the breathing process took place for a longer time in such a case. The lungs are histologically examined and they resemble the older child's lungs. And so the texture, and there is going to be quite a uniform expansion of the alveoli. There is going to be a pinkish discoloration to the lungs. There is going to be a patchy expansion of the lungs, and an uneven aeration under the pleural surface is also observed in such cases. Difficulty arises when paradoxical appearances are seen, because all cases are not of similar origin, of the similar intensity, and so if there is some sort of a paradoxical appearance, then it is quite difficult to establish whether the breeding took place or not. Now, the necessary part of the autopsy is to establish the maturity of the infant or to establish the maturity of the neonate. So, recording the size and the presumed age of the infant, and the it's basically a legal requisite to perform this estimation of the maturity. It's basically a personal variation compounded to prevent the accuracy. And this diagram is basically showing how the alveoli basically modify as the age of the infant passes. For example, it's going to be just the lung buds in the initial state, and then they're going to develop into the airways, that is the bronchi, and then the smaller airways, that is the bronchioles, are formed. So these are the changes that are going to be observed in the lung of the infant or the neonate. The female infants, they have 100 grams less weight at full term than the males, and the twins are lighter than the singleton childs. The apparent time of the ossification centers, it is no longer uniform, because it is no longer going to be indicative of the child's age, or it is no longer going to estimate the maturity in the children. The bell-shaped curve of the probability is again very important. The specifications of the full-term singleton fetus, that are going to basically be the weight between the 2550 or 3360 grams. It is going to basically establish that the child was a single one and not in a twinning factor. The crown heel length of 48 to 52 centimeters is going to be noticed. The crown rump length of 28 to 32 centimeters is going to be there. So these measurements and these variations are going to be taken in such a case. The head of the circumference, that is usually taken, that is again another variable in these cases, is 33 to 38 centimeters. The ossification centers in the lower end of the femur, they are going to be always present, and they're going to be obviously of 6 millimeters in diameter. So that is going to be the size of the ossification centers of the femur. The lanugo are absent or present only over the shoulders. Lanugos are basically the extra hair that are present over the shoulders, and that is again going to be present in a full term or in a mature fetus. So the specifications, the head hair are about 2 to 3 centimeters long. The testes are palpable in the scrotum. The vulva labia closes the vaginal opening. The dark meconium is present in the large intestine. The umbilicus is almost midway between the xiphisternum and the pubis. That is going to be the location of the umbilicus. The ossification centers in the upper end of the tibia, they're again going to be looked for. Now, if the fetus is 36 to 28 weeks, at 36 weeks, the crown heel length is about 45 centimeters. The weight is around 2200 grams. The ossification centers in the cuboidal fossa, the capitate bones in the lower end of the femur, and the upper end of the tibia, they're going to be there. And at 28 weeks, what are the signs we are going to look for? The weight is around 900 to 1100 grams, and the crown heel length is almost 35 centimeters. The crown rump length is almost 23 centimeters, and the foot length is almost 8 centimeters. There is a Hass's rule of thumb. So it's again going to basically point out towards the gestational period. This rule states that up to 20th week length in centimeters was square of the gestational period in the lunar month. So it has to be kept in mind. It is a common practice to apply this rule for the fetal age and the size, and is applied beyond 20th week of gestation. Length in centimeters is divided by 5, and it represents the age in months. Then moving on to the examination of the ossification centers, that is carried out and is performed radiographically. So it is basically seeking them at the knee level, and leg is flexed. Lengthwise cut is made over the patella, and the bones are pushed forwards through the cut. The transverse slices through the cartilage of the lower femoral end, they are taken, and the centers are revealed, and the cut should continue through the plain cartilage. So this is what we're talking about. This ossification centers are basically dealt in, how they are dealt in with at autopsy level, not in a living person, of course. So when we are talking about the foot, the cut is made in the axis of the limb and between third and the fourth toe into the ankle joint. And then to seek the cuboidal bone. Talus and calcaneum, it is entered by a cut across to the upper foot dorsum. And the appearance of the centers in calcaneum, it appears at the 7 months gestation. In talus, it appears about the 7 months, and in cuboid, it appears at the full term. So these are basically the centers, and how are they going to appear? Their sequence is basically described over here, and it has to be kept in mind when you're estimating the gestational age. So in this section, basically we dealt in with how are we going to estimate the gestational age of the fetus or the newborn or the neonate, and what are the different variables that are used over here. That is the end of this section. Thank you for watching sqadia.com.